A key player locally in response to COVID-19 is the Boston Public Health Commission. The commission is working on many fronts, from reinforcing the message from Mayor Walsh about the importance of social distancing to helping vulnerable people maintain access to services. To bring us up to date is the commission's executive director, Rita Nieves. Thank you very much for being with us, Rita.
Thank you, Chris, for having me.
Rita, one thing that we cannot get enough of is the mayor's advice: make sure you maintain social distance. What exactly does that mean?
Well, it means that we need to be really mindful about how we interact with each other these days, and it means to keep your distance, 6 feet from each other whenever possible. And you can practice that at home, you can practice that at your job, and you can practice that when you go to the supermarket, to a store, anywhere where you're interacting with people. Try to keep your distance. The idea is that you're not close enough that if somebody's, when we talk to each other, there are droplets that are coming out of our mouth that are invisible, that we don't see them, and they can fall on top of you, and then you can touch your clothing and then put your hands in your face, and that could be a way to transmit the virus.
Rita, how does that social distancing help with access to care for people who really need it quick?
Mm-hmm. So, if somebody's feeling sick at home, our recommendation is that they call their primary care provider, let them know what their symptoms are. The provider can make an assessment over the phone and decide if that person needs to come in. And then if they decide that you need to come in, they'll give you instructions as to what to do when you get there. The whole idea is that a person with symptoms who may or may not have COVID-19 walks into a waiting room, sits down next to other people who are sick or maybe healthy, just waiting with other people there, and have an opportunity for an exposure. So it's very important to communicate with your primary care provider before you go in, or your emergency department.
What about immigrants in Boston? You have people with different kinds of statuses. They have concerns about whether they can go and get care. What's the best advice for them?
Well, the best advice is to, if you're connected with a primary care, follow the same procedures. Call your primary care, talk to them, let them know, what's going on with you, and they'll give you instructions. And if you don't have care or insurance, call your health center, your local health center, or your emergency department near you, and get advice. We're fortunate in Boston that people who, regardless of their immigration status, are welcome in our healthcare system, regardless of their status. So call a provider, let them know your fears, so they can reassure you, and you can come in and get the care you need.
And I imagine one simple shortcut is, if you don't know the number for your local neighborhood health center, call the city's number, right?
311 is the best number, but we also have the mayor's health line, and the number is 617-534-5050. We have people there who speak different languages, so they can advise you, and if you don't have health care coverage, they can also advise you on how to get coverage.
Now, there are people who will keep their distance. They'll stop doing things that are not essential, but some things are essential. People still need to go to the supermarket to get food, maybe. They might have to take the T to get to work, and some of those trains can get crowded. How should people deal with that?
So one of the things that the fact that the schools are closed, so many people are teleworking, and staying home and working from home, is that there's less people out there. Even driving, there's less traffic in Boston right now. So take advantage of that. If you do have to go out because you have errands to do that are important, keep your distance. If you walk into a bus or a train, find a place or a way to be at least 6 feet away from people. And if the bus is crowded or the T, wait for the next one. Just find the opportunities for you to create that distance between you and other people.
And I know some of those supermarkets can get crowded, so if there's one section, maybe you can move on?
Correctly. And, I heard this morning that there are a couple of supermarkets that are creating hours for people over 60, so they can go early in the morning. So take advantage of those opportunities if you're in that high-risk category, and go when there's less people in the supermarket, usually in the morning or at the end of the day. And also, if you walk in and the section where you want to go is crowded, move on, go somewhere else, come back, and keep your distance as much as you can.
And speaking of food, I guess another thing that people can do is check out meal sites for their kids.
Yeah, that's correct. BPS has created a number of sites for meal distributions, and they continue to reassess, those locations depending on need. So people can go to the BPS website, and they can find there the places where they can go in their neighborhood.
Previously, you were in charge of helping people with substance abuse problems. What about the problems they have now? Because they have to have a lot of follow-up. What could be done for them?
So all of our recovery sites are open and in full operation, and we will continue to be for forever. So we don't intend to close anything. And on the contrary, we're having to extend our hours and really be more present, because as other sites and services have diminished, in the city, we're going to end up having to really focus on serving the most vulnerable and the people that have no place to go. So we will continue to be open to help with access to care, to place people in treatment, to place people in help them get into shelter, whatever they need. We're there for them.
Finally, the Commission's also putting out some circulars this weekend. What do you want to get across in those?
So this is like one more tool, one more method that we're trying to use to get the word out about the basic information, how to stay healthy, how to prevent, getting sick. And we realize that not everybody, connects to the internet. Not everybody has a cell phone. So this is another way we're going to get written materials to every single household in Boston.
And in many languages too, I imagine.
In many languages, because we're a city that speaks many languages, and so we're going to drop them off in each household. We're getting resident volunteers to help with that, and it's the another way for us to make sure that we are getting to every single home in the city of Boston.
One other thing, there are some people who are older, maybe not necessarily that old, but they might be out of touch. What about how neighbors can help them?
So if you have a neighbor that that it's elderly, does not have much family or many connections, knock on their door, talk to them from the walkway. Make sure that if they need groceries, you can help them go get them and leave them on the steps for them. Connect with them every day, because, isolation can be, a difficult thing for anybody, but especially people who are elders. So reach out, or call them, get their phone number, call them on the phone. Find other ways to reach out to them and connect with them without having to be face to face.
I know every day brings new updates. You've got a website for that, so what should people look for?
BPAC.org. It's one way that people can get a lot of information. Also through the cityofboston.gov, we have a COVID-19 site, so you can click on that and get also information.
Thank you very much for being with us.
You're welcome.
Rita Nieves from the Boston Public Health Commission. We'll have more news in just a moment.